everybody, and welcome to today's episode of We'll Do It Live. I'm very sorry, I'm about 20 minutes late, and I have a very good reason for it. So, without any further ado, let's get straight to the topics for today. And as you see, the very first one is criticism on my recommendation that we should suspend Vermont's Certificate of Need laws. So I had a very long conversation just now with John McLaury. For those of you who aren't aware of him, he is the founder of the Ethan Allen Institute, which is a think tank in Vermont, the only one which is right of center. He was a president for a very, very long time, and now he's the vice president. He's in his 80s, so he has incredible institutional memory. I think he has a master's degree in physics and economics. So he's a very smart man, and I'm very privileged to know him. I respect him a great deal. And whenever I have a question about any very complicated policy issue, he's the first person who I call. So I wanted to talk to him about this whole idea my question to him was basically, why aren't they suspending the Certificate of Need laws? And here's why. Because just today there was a report, and this was covered by a lot of the local media, about a modeling, like a computer model that sort of projects how many patients can Vermont expect, when can the coronavirus pandemic, when will it be at its highest, which is about mid-April, how many hospital beds will we need, how many ventilators will we need. And so just very briefly, I'll tell you the numbers. They're expecting, so according to this modeling, and it was released by the Scott administration, the likely scenario that they're saying is that we will need 211 intensive care unit hospital beds at the peak. And right now, 135 are available. So there is definitely a gap. We'll also need 114 ventilators. We have 93 available right now. My understanding is that they have placed an order for more ventilators, and they are on the way. So I wanted to understand, okay, well, we obviously have a need to have more hospital beds. Our healthcare capacity is, for various reasons, limited, and so we need to increase it. So why don't we suspend the Certificate of Need laws? And I couldn't really get an answer anywhere, which is why I called John, and he said that, well, as far as he can remember, no one has attempted to open up a hospital, like a brand new brick and mortar institution with services, inpatient services, hospital. No one has done that for decades. And this is his opinion, no one will ever do that in Vermont again. And the reason why is, of course, there are many reasons for it. But when you look at the economic situation of our state right now and the demographic crisis, we're actually seeing smaller hospitals, not even rural ones, one in Springfield, closing down, a lot of hospitals going bankrupt. There's a shortage of physicians and nurses. As a result, everyone's losing their jobs and leaving. And so there's not going to be any new institution that comes and makes a new hospital. So the way that the con laws work in Vermont is that, yes, he agreed that it's basically a competitor's veto, which means that if somebody wanted to expand an existing facility, they would present economic competition to UVM, the UVM network, and that very politically powerful monopoly. And so UVM, which has a very cozy relationship with the legislature, will then issue a competitor's veto, as it's known, and end it. And John McLaury gave an anecdote about how a southern-based primary care provider, it's a network, they submitted a certificate of need petition, and he attended that meeting, and the UVM lawyers said, no way, we're not doing that, because they want to protect their practices. And so as a result, the Southern practice did not get they did not get approval, and they had to leave Vermont. So in essence, the way that con laws work, according to my understanding with this lengthy conversation, is that it serves as a subsidy to existing providers. It's a subsidy that that we are, let's say we are giving, the government is giving its favored monopoly. It's giving a subsidy, and at the expense of everyone else. And the way that it really works out, and I've talked a little about this, is medical imaging. So for example, to get an MRI at UVM, it's something like $4,000. A competitor wanted to open up shop nearby and was offering MRI services at $800. See, that would undercut the prices of UVM. So that facility, that MRI facility, doesn't get permission. Okay, and why does it cost $4,000 at UVM? It's because they're trying to cover their very expensive overhead costs, and they are trying to pay off their debt because they have a lot of debt. And so you see, when you pay $4,000, it's not really because they have an amazing MRI. You can get that very same service for $800, but there are all these other reasons why the cost is more, because UVM needs that extra money. And so then if the state prevents other options, it cuts off other options through the con laws and allows UVM to be the only MRI provider, no matter how much they charge, $4,000, $5,000. You see how that is now a subsidy that they are giving to an existing provider. And so this is how con laws work. Now, in the case of saying, okay, well, we have a pandemic, we need to increase the number of beds, we need to suspend the laws. Well, another piece of news today was that the governor has employed the Vermont National Guard to build 2 new medical surge sites. This is all in the Chittenden County, where we're seeing the maximum number of COVID-19 cases. They want to add an additional 550 beds because we're expecting more patients. So this is basically, they're setting up these temporary facilities in Essex Junction, and actually another one in Rutland County, Burlington, St. Albans. So you can see sort of relatively heavier populated areas. They're setting this up. And so I wanted to know, I was like, okay, well, obviously this is different. If the Vermont National Guard is stepping in, this is an emergency, and they're making these temporary adding beds, as we've seen the Chinese government did as well. They don't need state permission. They don't need to put in a petition, to get to show that there is a need and pass the certificate of need laws process. They don't need to do that. That's because the understanding is that this is temporary, and after a couple of months, when this pandemic passes, it'll go away. We won't have to worry about that anymore. And so the criticism that John McClory gave me was that he thinks that my argument that we should suspend the con laws, and so that we can have more hospitals and we can have more facilities, is like me using or manipulating, maybe that's a harsh word, capitalizing on the pandemic to push a policy agenda that I already support. Yeah, so he doesn't find it, he in general wants the con laws to be repealed, although he doesn't see any political will that would happen. He doesn't, this is his words, he doesn't find it compelling to do it now and say, oh, there's a pandemic, and so therefore we should do it now. And this slightly echoes what Dr. Meyer said as a comment to my commentary, which was published 2 days ago in Vermont Digger, where he said that we should be supporting our smaller hospitals. We don't really need more hospitals. So I would like to, I was thinking about that, writing my notes, which is why, and the conversation went longer. And I think this is really important, and I really wanted to address it today instead of putting it off till tomorrow, which is why the delay in starting the Facebook Live series. But as you know, the goal of this Facebook Live streaming for half an hour every day is to share relevant information along with well-researched and well-reasoned analysis. And it just so happened that I got all of this new information like right at 10 minutes before 6. And so anyway, so that's what, and I was writing some notes about it, and I'll think about it a little more. But my initial thoughts are this, that I'm not so. First of all, I talked about yesterday how it's politics as usual, and there are a lot of our leaders, not only in Vermont but across the nation, that are using this crisis to then ram through a policy agenda, an ideological position that they already support. And so to say that I'm also doing that here, I don't agree with that. I disagree with that. My main point is very simple. We should be in or we should have been in a very strong position moving into this pandemic when it hit. We should always be prepared. We should always be and always have a solid economic foundation, a solid foundation for our government in terms of fiscal strength. I mean, we shouldn't be billions of dollars in debt. Obviously, we should be accountable. Our elected officials especially should be accountable. There should be transparency when we have bureaucracy. So this is basically my position. So if I have a predetermined agenda, it would be this, that or policy agenda or policy position or ideological orientation, if you will, that it is this, that government should be responsible. It should have fiscal restraint. We should not be spending more than what's coming in. We should be funding our obligations like the pension debt. I mean, I'm just saying, so this is how it is. So if that's the case, then I think that if you have a pandemic, and okay, not pandemic, but we have epidemics. We had one in 2009, H1N1 flu, 2003, the first SARS COVID virus. I mean, this happens all the time. We know it. So we should be prepared for it. And we are not. Now, I'm going to refer to the Mercatus Institute. They have a study right here. What they did is they pre-released it, as they call it, their study about where they assessed every state, and they looked at healthcare openness and access. They looked at it to see how ready was each state to deal with the crisis. And that's what I'm getting at. When we look at that in 2020, Vermont, overall, we are 43rd. We place 43rd when it comes to overall healthcare openness and access. Okay, we are 45th and 47th when it comes to the regulations that we impose on health insurance and the operational constraints that we impose on hospitals, insurance companies, pharmacies, etc. So we are going in with a serious handicap. We are going in with a lot of red flags. And the most immediate effect is that our healthcare capacity is not sufficient to meet the needs of the pandemic. Now, we are not New York City. We're not in the epicenter of this crisis. We have 600,000 people, including children. Let's say a few people come in from a few hundred come in from New York and neighboring states. Why should such a small population, such a sparsely populated population, why should we be underprepared? Why are we running out of beds? Why are there 100 beds less or 150 beds? Why? And that's what it speaks to, a much greater problem. And one of those reasons is the con laws. So I'm not saying, oh, you know what? This is a magic potion. Let's suspend the laws and everything is good. We'll have many new facilities and that will solve the problem. No, I'm not saying that. I'm saying that that right now we have a crisis in that our healthcare capacity is not enough. So we need to do something to expand it. And that is not just the state government stepping in, like the governor stepping in and employing the National Guard to make temporary sites. We can get other people to also innovate, other providers to also come and say, hey, look, I'm a Manchester resident. I can set something up right here. And this is especially true for places that have an ability to have medical imaging technology. I can provide x-rays, I can provide MRIs, I can provide CT scans, but I don't need to go through the lengthy, restrictive regulatory process to get it done. I can act quickly and have it done quickly. And that's my point about what I'm trying to say. I'm not saying that this one thing will solve it all. I'm looking at it from a 30,000 foot bird's eye view, and I'm saying, okay, this is definitely a problem. This is definitely a problem, and so we should address that. Now, on that note, I'll say two things. Actually, I'll say one thing, which is two parts. This is definitely an unprecedented time, and so I'm looking out for leaders. I'm looking out for emerging leaders, established leaders, and I'm looking at how they're acting. Are they hoarding onto power, as I've said before, or are they making way through deregulation, through getting rid of crony restrictive laws, or at least suspending them, making room for innovation, making room for entrepreneurs to come forward and innovate and come up with solutions that we need right now for these various, it's a very dynamic situation and we have many problems. So are you making room for that, or are you holding on to power, consolidating everything and saying, no, I know best? So when I look at that, I think a good leader should have a two-pronged approach. Part one is to look at the crisis at hand and deal with that. But the second one is a more long-term approach where you're thinking about, okay, why are we failing? Why did this happen? Well, we entered this crisis because of where we had ABC handicaps. So the long-term strategy is, how do we address that? How do we change that? And the con solutions, even if, let's say, people don't suspend it right now, getting rid of con laws is a part of the long-term solution that we absolutely need to address, and we need to be thinking about even as the crisis keeps unfolding and the surge keeps increasing. So that's what I will say to point number one, and this ties into the second one, which is about Vermont's plastic bag ban. So as you know, our legislature passed a law saying that grocery stores will be banned from providing plastic bags to customers effective July 1st. And this means that customers will have to bring reusable bags, and the whole point of this was climate change. Plastic bags are banned. Now, I'm not going to argue and get into all that, but I will just say that the entire world has changed. Everything has changed, and we all know that. So right now, what we're trying to do, everyone is focused on what's known as flattening the curve, right? So as I said, instead of having everyone fall ill at the same time, we're trying to flatten it out so that, sure, people will get infected, but people don't have to fall ill all at once and then lead to overburdening of our hospitals and then, God forbid, rationing of beds and ventilators. So we are trying to slow the contagion. We want to slow the spread of the virus. And we want to protect the health of Vermonters and Americans broadly, but in terms of Vermont, we want to help people, especially people who are on the front line. And this is not just in hospitals, but this is in all our essential businesses where, for example, grocery stores, where people are still going and working and bagging groceries and helping, the rest of us buy food and stay alive. So when you have a reusable bag, that is a reservoir that becomes an absolute reservoir of infectious germs and diseases. And we do know that COVID-19 spreads by contact. So tell me, why would we not suspend or just end this bag ban? Why wouldn't we do it? I mean, I would think that's the very first thing that you do. You look at the laws that you have in front of you and say, okay, everything needs to be prioritized to protect public safety first, right? Public health, and how do we slow the contagion? Well, one great, wonderful way to slow the contagion and protect our workers is to suspend, pull back, repeal, do whatever you want, but get rid of this ban that goes into effect July 1st. Why aren't we ever doing that? And you know what? In New Hampshire, Governor Chris Sununu, he used his executive authority as governor of the state to say no. Now on, New Hampshire grocery stores have to provide plastic bags, and we're not going to go ahead and do this whole reusable thing. Okay, so nobody wants to as I said, it's politics as usual. So no one wants to pay attention to a Republican governor. Fine, don't. Here's a list of states and cities that are run by Democrats that have all pulled back on the ban: New York State, Massachusetts, Maine, Albuquerque, New Mexico, and San Francisco in California. San Francisco had in place a 13-year ban on plastic bags, and they have reversed it. Not only that, they have now prohibited reusable bags. So if all these places can do it, why can't Vermont prioritize public safety and public health? I am going to keep beating the bush on this every single day. I'm going to keep retweeting it because I think it's very, very important. Yes, it's that important, and we really need to stop it. I mean, why not? So I spoke with a reporter off the record today to just find out what's happening, because Governor Phil Scott said, I don't know why the executive authority in Vermont is different from executive authority in New Hampshire. I thought that generally speaking, governors have the same authority, but I don't know. I have never been in office, so perhaps I'm missing something, but he said that it's not up to him to do anything. He doesn't have the power to do anything about the ban. It's up to the legislature. Okay, so Tim Ash is the Senate president, and Mitzi Johnson is the Speaker of the House, and both of them have put out their COVID-19 priorities. And so I was talking to this reporter off the record, and he said that they have been approached. This is a topic that is on our minds, and we have asked them. And you know what they said? It's not a priority. It's not a priority. And doesn't look like it's going to be a priority in coming weeks, which I find very, very shocking. So I have a comment from Janet, and it's about the plastic bag ban. And she says that the bag ban will be rescinded because all the greenies have stopped using that. So she's hopeful, she's more optimistic, and she feels that, okay, you know what, maybe that's true, that can happen. So if San Francisco had to reverse this 13-year ban, this means that it must be really bad. But I'm just fearful that, I don't want it to be that we get that many cases and, God forbid, more deaths, and then that forces the hand then of Tim Ash and Mitzi Johnson to then take action. Why can't we just do it now? I don't want to be inflammatory about it. I'm not going to use the language that the mainstream media uses. I'm just saying that we should prioritize safety, and this is one simple action. It's a small step. It hasn't even gone into effect, so you don't have to do anything. You just have to say, pause. Just press pause on it for, I don't know, a year or something, and then we can revisit the issue. But just do that, because then it shows that you're taking this seriously. On the one hand, we have been told that Vermont needs to be ready for months and months of shutdown. Months, that's the word that was used. Months and months of shutdown, because slowing the contagion is so important. Not overwhelming our healthcare facilities is so important. And I think Peter Welch said that in a press conference with the governor, that, the economy will be compromised, but that's just how it is, because public health is important. Okay, that's one. The second is that now we have a rule where retailers like Walmart, for example, can't sell non-essential items, which some people might, as I said, argue what is essential, what is not essential. You have the power to do that. I spoke today with a Vermont real estate broker who told me that he got a notice from the real estate, the Realtor Association, saying that they're absolutely not allowed to do anything at all, including an appraiser. There's a house that's on contract, it's all set. The appraiser just has to go into the empty house where there's nobody and appraise it. No, he can't do that. He can't do that. Another one is, there's a person who's very interested in a house. It's not occupied. It's not been occupied. It's just sitting there idle. And this interested buyer just wants to go alone, just on his own, and look at it himself. That's also, he's not allowed to do that. And if the the real estate broker with whom I was speaking, if he allows them to happen, then he's going to get in trouble. So since we're taking such severe actions, where, I mean, really, so you can't even go in and look at something alone? No, you can't do that. Another example, I'll tell you. This is in the Northeast Kingdom. There's a local lawn mowing company, and they want to mow the lawns of some elderly people who live in that community. For example, in one house, there's an elderly woman. She lives by herself. She'll just be inside the house, and then the lawnmower company, it's just one man. He'll go in, he'll do the lawn for her, and they won't even touch each other. They won't have any interaction. But no, he's not allowed to do that. So we're taking all these very, 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 very severe, or maybe it's needed. I don't know. Maybe, we're taking all these actions because safety first, but not plastic bag bans. I don't understand the logic. I don't understand the logic at all. Okay. So, do I have? Yes. And there's one last thing that I'll say today that I promised I would talk about yesterday, which is, again, going back to the con laws. But so how much, I said that I'll tell you how much money we would have saved, So the con laws, and going back to that, is very important. I really feel that right now, because of the pandemic, my sincere hope is that people will pay attention, and because these are boring topics, right? Generally speaking, it's like, oh, what is this? Complicated law, regulation, it's boring. But I really hope that the people of Vermont see how it has a direct bearing on all our lives. And these are, yes, they're obscure, yes, they're complicated, but we can together unpack it and we can make sense of it. And then we need to vote in people who fight these laws. These are crony restrictive laws, who question the status quo and the system. So my last point is, the con laws, in theory, are supposed to bring down healthcare costs. We know that they don't. They protect monopolies. So what is the actual dollar amount that would have that affects us in Vermont? Okay, so let me pull it up really quickly. Okay. Per person, when it comes to total healthcare spending, without con laws, we would save $228 per person. Okay, and when it comes to physician spending, so when it comes to primary care and specialists, without the con laws, it would be $68. Now, $68 is not anything to laugh at. That's quite a lot. So $68 saved without con laws for physician spending, and $228 saved without con laws for overall. Did I say per person? I'm sorry, I meant per capita. So annual per capita healthcare spending patterns without con. Total would be 228 saved per capita and 68 for physician spending per capita. So it has a direct impact. It has increased healthcare costs, decreased access, decreased our ability to be prepared for this pandemic. So this is something that we really need to fight. And as I said, I would have hoped that short term also we could suspend it and then long term repeal it. But if there's no political will to do anything short term, all of us in Vermont should remember that good leaders, wise leaders, will look at the structural reforms that are absolutely critical moving forward. And I'm not talking about 10 years. I'm talking about next 2, 3, 4 years. There are great structural reforms and changes that are absolutely required if we want Vermont to survive moving on. I think that over the next couple of months, as we see the budget shortfall, that means how much money the state has not been getting. So I think the picture is then going to get a lot more clear. Normally during a recession, the income taxes go down because people lose their jobs. But in this case, we're also going to see a drop in sales tax. And so there are going to be huge holes in our budget, and that's going to be a great reality check. This has never happened before, so I don't know what the picture is going to look like. And I don't know how hard a hit we're going to get and what's going to happen. So on the other side of this pandemic, what will Vermont look? I don't know. but it's not going to be good. And I'm not trying to scare anybody. I'm just saying that that's why it's important for us to be aware of all these issues and choose good leaders, wise leaders who have a plan, who have a vision, and who are willing to address the structural problems that we have. We have a lot of structural problems. They need reform. It's not an easy fix. It's not going to be an easy fix, you know. You can't put a band-aid on it when your bones are broken. That's not going to work. And also remember, who are the people that brought us to this point? What is the legacy? Who has, especially in the last decade, who has been in power? Who has presided over the House and the Senate over the last decade? Because this is their direct legacy. I have one more. Okay, I have one more comment from Matthew. Well, yes, our politicians are then beholden to donors. This is true everywhere. But then see, that's part of the game, because money is a very integral part of American politics. But if you're not going, you don't have integrity, you don't have character, you don't have a real love and passion for your fellow Vermonters, you don't really see, like, when you see the future of Vermont, is it one where everyone's prosperous, everyone's free, everyone's doing well? Or is it a future in which you are wealthy and you can own third and fourth homes all across the nation? That's a big difference, I think. And so it will fall on us. I think this is going to be, 2020 is going to be the most important election, I think, in many years, because it's going to be very consequential. And I'm going to be here every day, 6 p.m. I will be here at 6 p.m. 6 p.m. every day. I'm just sorry about today. Take it up with John McLaury. So I'll be here back again 6 p.m. and we'll be together throughout this entire process, and we'll talk things through. If you have any questions for me or any topics that you'd like me to address, please email me at info@hansen, HANSEN, for Vermont.com, or you can leave comments on my Facebook page, on the campaign Facebook page, and I'll get to it. Okay, see you tomorrow.